Although snoring may be harmless for most people, it can be a symptom of a life-threatening sleep disorder called sleep apnea, especially if it is accompanied by severe daytime sleepiness. Sleep deprivation is linked to health problems such as obesity and high blood pressure, negative mood and behaviour, decreased productivity, and safety issues in the home, on the job, and on the road. Teenagers need more sleep than adults, but their internal biological clocks also keep them awake later at night and make them want to sleep later in the morning. That means many teens come to school too sleepy to learn. Excessive daytime sleepiness can occur even after getting enough sleep and can be a sign of a medical condition or sleep disorder. These problems can often be treated and symptoms should be discussed with a physician. Sleep experts recommend a range of 7 to 9 hours of sleep for adults of all ages. However, older people may wake more frequently through the night and may actually get less nighttime sleep, so they may need to make a nap time part of their daily routine. Although the stereotypical description does fit people at the extreme end of the spectrum, we now know that even young, thin women who don't snore can have significant obstructive sleep apnea. Sleep apnea begins with the jaw structure narrowing and later involves obesity. It's estimated that 90% of women with this condition are not diagnosed. Untreated, it can cause or aggravate weight gain, depression, anxiety, diabetes, high blood pressure, heart disease, heart attack, and stroke. For some people, sleeping on your back is ideal, but many people naturally prefer to sleep only on their sides or stomachs. They must sleep in this position for a good reason. Their tongues fall back due to gravity, and in deep sleep with added muscle relaxation, they can stop breathing. Dermatologists are always telling female patients not to sleep on their stomachs to prevent facial wrinkles, but actually this will worsen wrinkles since you won't sleep well at all. There's no way of proving that you don't snore or that you don't have sleep apneas, which is where you stop breathing while sleeping, without undergoing a sleep study. Even bed partners can't really tell. Most people do stop breathing once in a while. Also, if you don't snore, you may not be breathing either. There are people who stop breathing 50 to 70 times every hour and feel absolutely normal, but they're at increased risk of heart disease, heart attack or stroke. Sometimes. It's definitely worth trying, but in general it's very difficult to lose weight if you have sleep apnea. This is because poor sleep aggravates weight gain as well as increasing your appetite. Once you're sleeping better, it'll be easier to lose weight. This is the one ingredient with many dietary and weight loss programs that's missing or not stressed at all. It's not enough just to tell people to sleep more. Having a stuffy nose can definitely aggravate snoring and sleep apnea, but in general it's not the cause. A recent study showed that undergoing nasal surgery for breathing problems cured sleep apnea in only 10% of patients. Snoring vibrations typically come from the soft palate, which is aggravated by having a small jaw and the tongue falling back. It's a complicated relationship between the nose, the soft palate, and the tongue, where other cures such as a dental mouthpiece will help more.